Welcome to Simply Women's Health with CJ. I'm your host, CJ. I've created this channel as a place for you, the healthcare consumer, to come to get reliable information about the female reproductive system. These videos are in no way meant to replace a visit with your healthcare provider, rather as a place for you to come to get information that maybe will help you figure out what questions to ask at your next visit to best optimize your healthcare needs. If you feel as though these videos have been helpful, I would love it if you would subscribe and or like. If you know somebody who you think might benefit from this information, please don't hesitate to share these videos. I appreciate any and all support you can give. That being said, let's go ahead and get started. Hello. Today we're going to talk about the intrauterine device, or the IUD. There's two basic IUDs on the market. There's IUDs that contain hormones, and there's IUDs that don't contain any hormones. Today we're going to focus on the hormonal IUD. There's a number of different products on the market. Today we're going to focus mostly on the Kyleena as well as the Mirena, only because those are the products that I use in my practice. Mirena is good for 8 years. It's recently gotten the FDA approval for 8 years. It used to be 5, but now it's 8. And then there's Mirena's little sister, Kyleena. Kyleena is good for 5 years. Kyleena was developed specifically for women who have never had a baby. Kyleena actually replaced Skyla, which used to be on the market. Skyla was good for 3 years, but now we have this device, which is actually good for 5 years. So how does the IUD work? The IUD is a plastic T. Although it is white, it is not teal. Within this barrel is 8 years worth of the hormone progesterone. The job of the progesterone is to thin out your uterine lining. It tells your ovaries to stay asleep for the most part, and it changes the pH of your cervical mucus, making it hostile to sperm. This device is 99.8% for pregnancy prevention. Notice I did not say 100. The only way that I can promise you that you will not get pregnant is if you don't have sex or you become a lesbian. Otherwise, if the penis and the vagina are in the same room, there is always a chance. When we do this procedure, there's risks: infection, bleeding, pain. There is a risk we can perforate the uterus, put this out into your abdominal cavity, requiring you to go to the operating room to get it taken out. It's very rare, but the risk does exist nonetheless. Because this device thins out the uterine lining, you can expect unexpected bleeding for about 3 months. After 3 months, the bleeding will calm down. After 6 months, you'll know the full effect of the device. 85% of women report shorter, lighter, or even absent menstrual cycles with both Mirena as well as Kyleena. A small percentage of women will have increased acne, a small percent will have increased depression symptoms, and a small percent will have ovarian cysts. These are just things that you need to be aware of. So you and your provider have decided that the hormonal IUD is the best option for you. They're probably going to instruct you to not have unprotected sex for 2 weeks prior to the IUD insertion. I usually encourage my patients to take some kind of a pain reliever, whatever they use for cramping, an hour before their appointment time. When you get to the clinic, they are going to want to do a pregnancy test. We have to make sure you're not pregnant before we put this device in. Your provider is going to sit down. They're going to go over the risks and the benefits, and they'll probably have you sign a consent before we put the IUD in. Then you're going to get on the table. They are going to insert a speculum into your vagina. They're going to open up. They're going to look for your cervix. Once they get your cervix in view, they're going to clean off your cervix with a little bit of betadine. If you're allergic to shellfish iodine, anything in the iodine family, let your provider know, because there are alternatives for patients who can't tolerate the iodine. After they clean off your cervix, your provider is going to put a sound. It looks like this, and it's got little measurement things in. They're going to go all the way up into your uterus, and they are going to see what is the depth of your uterus. Then they are going to get the IUD. They're going to get it out of the package. They're going to put it up in. They're going to pull out the applicator, trim the strings, take the speculum out, and call it a day. As I mentioned before, there are risks associated with this procedure. After the procedure, I usually ask my patients to not put anything into their vagina for the next 7 days. I want those IUD strings to soften up. They typically wrap around your cervix. You don't even know that they're there. After you and your partner resume intercourse, if he says that he can feel the strings, I usually tell my patients, I don't frankly, I don't care if he can feel the strings. I do care if he feels something hard hitting him during intercourse. 2% of women will spontaneously expel or push out their devices, and if that happens, it is not an emergency, but it is something that you do need to have evaluated. They can do an ultrasound to make sure that IUD is where it should be. If you are running a fever, if you have foul-smelling vaginal discharge, severe pain not managed by ibuprofen or a pain reliever of your choice, if you are bleeding heavy enough to saturate a pad, you do need to contact your provider. I usually encourage my patients once a month, somebody put their fingers up in there and feel for those strings. I don't want you to measure them. I don't want you to tug on them. Just make sure that you can feel them. If you can't feel them, again, that is not an emergency, but you do want to contact your provider and have them put a speculum in and make sure that they can see those strings. Some providers will have you come back for a 6-week string check. That is totally provider dependent, and whatever they recommend you do is what I recommend you do. So that's all we've got for today. This is CJ. I'm at your cervix.